Okay, good afternoon, everyone. Welcome to the first ChicagoCHEC Seminar Series. Today's series will be on policy brief. And I will my name is Beverly Chukwudozie. I'm a program director for ChicagoCHEC at the University of Illinois Cancer Center. I will introduce one of our multi-site PI to introduce our speaker, Dr. Marian Fitzgibbons.
Thank you, Beverly. And I just want to reiterate what Beverly said. This is the ChicagoCHEC Seminar Series, and we're very happy today to introduce Dr. Joanna Buscemi. She's going to be giving us an overview on policy briefs. Dr. Buscemi is an assistant professor at DePaul University in the Department of Psychology. She's also chair of the Health Policy Council at the Society of Behavioral Medicine, and also is a co-investigator on one of our ChicagoCHEC projects that focuses on technology-delivered interventions for Latinas. So today she'll be talking wearing her policy brief hat. She's going to be presenting on developing and disseminating policy briefs. So Joanna?
Thank you so much for that introduction. And I think, Beverly, you were going to say something about...
Yes, I just wanted to tell everyone that if you do have any, we'll have some time to talk, to answer some questions at the end of the call. I think everyone currently is on mute, but if you have any burning questions that you want to, please feel free to enter all questions in the chat box, and we will open for questions and also ask some of those questions and then follow up at the end. To get more information about ChicagoCHEC, here's our information and if you want more additional information of our upcoming events and upcoming seminars, you can find them here on our website and our email. Thank you so much. Joanna, up to you. Over to you.
Great, thank you so much. I'm so happy to be here today. When we initially planned this, we didn't know it was going to be during a pandemic, but here we are. You could probably say that for most things that you had planned in the months of March, April, or May. So we're just gonna have to get through this together, but I'm really happy to give you all a break, hopefully, from thinking about COVID and talking a little bit about health policy advocacy and how you personally can start learning how to advocate for health policy changes. And just as a bit of background, I was trained as a clinical psychologist, and I always talk about this because clinical psychologists do not get a lot of training in how to advocate in terms of health policy at all, actually zero training. But I was lucky enough when I worked in the Institute for Health Research and Policy at UIC, when Marian Fitzgibbon was my mentor, she got me involved in the Society of Behavioral Medicine. She was the Health Policy Committee chair, then the president, then the Health Policy Council chair. And through being involved in this organization, we've kind of taught each other and gotten some really great training in how to write for policymakers. We get trained very well in terms of how to write for an academic population. We're very good at talking to other academics, but unfortunately that limits the reach of our research. And so, you know, it's really important to me, and I hope at the end of this you'll feel like it will be important to you as well to really learn how to talk to these other audiences that can make higher level changes that can affect population level health. So just as an introduction, I didn't have any training in this in graduate school, but have received training over the past 7 years or so, and it has really enriched my life. I feel like it's increased the impact of the work we do as behavioral scientists, and I'm just excited to learn more and to keep moving our policy agenda forward in terms of SBM. When I say SBM, that's Society of Behavioral Medicine, just so you know. All right, and I think this is especially appropriate for ChicagoCHEC, given that a lot of the policy statements that we develop are related to health equity and cancer. And many of the collaborators on ChicagoCHEC have been involved in the writing and the dissemination of health policy briefs. We've also had community partners collaborate with us and endorse our briefs. And so for those of you who have not been involved yet, this is an opportunity for you to do so and to really connect your work with policy. Oh, that's Beverly, okay. So we're going to talk about the Society of Behavioral Medicine's procedures for developing and disseminating health policy briefs. And don't worry, this webinar was developed for those of you who haven't had any experience. So I'm going to give you some tips for writing effective briefs. How do you write for different audiences? What are some tips that we've used in terms of disseminating the briefs? Because as Marian says frequently, like, a health policy brief is also no good if it just sits on your website. So we have developed some ways to develop, we've developed some dissemination strategies, and then some time for questions. So as Marian mentioned, I'm currently the chair of the Health Policy Council within SBM, which oversees the health policy work of the organization. Under that umbrella is the Health Policy Committee, which Marian and I have previously chaired, and it's now being chaired by Dr. Akila Doolin at Brown University. And the members of our committee are diverse in every way in terms of discipline, geographic region. And so we really want our committee to represent different areas within behavioral science. I wanted to mention the mission of this committee. So the Health Policy Committee identifies, assesses, and develops key opportunities to inform the policy debate at the federal and state level on issues related to our SBM mission. We develop policy positions, and they are reviewed and approved by our executive committee. And the idea is really to highlight some of the contributions of behavioral medicine and to close research to policy translation gaps. And I'll talk about that a little bit more later in the presentation. What we do is we take a position on a current issue that's affecting policy in the area of behavioral medicine. Our health policy briefs are a collaboration between committee members, experts in the field, our special interest group members that provide us with expertise in specific areas depending on the topic of the brief, and also our community partners. When Marian chaired this committee, she really revamped it in a way that has made us extremely productive. And the model that she put forth was to have an early career investigator take the lead on a health policy brief and to get training from the committee and also from more senior members of SBM. And these drafts of these briefs are proposed. The proposals are reviewed, and also the full briefs, and the committee provides feedback. And then we approve them and send them up to the executive committee, and then we seek out endorsements from partner organizations. When our committee began, most of the ideas for our briefs came from the committee itself, or maybe the staff of the Society of Behavioral Medicine, and then we reached out to experts to put the briefs together and contacted, and then that was our process at the time. But then we decided to involve our special interest group chairs and members to collaborate on them. And when we started doing that, we realized that a lot of our membership had ideas themselves. So we started putting together a proposal process so our members could actually propose health policy briefs. So anyone who is an SBM member can propose it. We also have non-members who propose briefs, and as long as they have a member who is a co-author, particularly a more senior member of SBM, then that's acceptable too. So that is possible. I know some of you might be members and some of you are not, so that's okay. And then the final step is partnering with those like-minded organizations to help us increase the dissemination of our briefs. So I take a step back a little bit now that you know what the Society of Behavioral Medicine does in terms of our process. But the meat of this presentation is really, what is a health policy brief? To be completely honest with you, when I first started participating in the committee, I don't think I really understood what it was. And if you Google what is a health policy brief, you get various definitions and explanations of what it is. So I have some of them here. I think they all fit pretty well. A concise, this word concise is very important, a concise summary of a particular issue, policy options to deal with it, and recommendations for future legislation. So that's really important because there's a focus on the issue, there's a focus on what can be done in terms of what can policymakers do, and specifically what are those recommendations. Another definition is a document presenting findings and recommendations of research to a non-specialized audience. So this is very important as well, that you are writing for non-academics. And so the language has to be consistent with that. Means for exploring all sides of the issue. So what we try to do with the briefs too is we don't want to present, if we can help it, we don't want to present just a biased presentation of the issue. We really want to explore some of what the opposition might say, and then talk about how the evidence really supports the argument that we're trying to make. A vehicle for providing policy advice. And I have a comment here that says it's not a research brief, because I know a lot of academics and some organizations will put out research briefs that are a brief summary of the literature on a certain topic. So let's say a research brief on psychosocial issues and cancer survivorship that describes all of the research that's been done in terms of treatments. And it does it kind of in a 1-page or 2-page format. The reason that is not a brief, that's a research brief because it's a summary of the research, but it's not a policy brief because it does not have a specified audience of legislators or policymakers. And it does not have specific recommendations that are policy related. So for example, a policy recommendation is not, more research is needed in this area to figure out the best way to provide psychosocial care for cancer survivors. That might be a research recommendation, but if you picture yourself sitting at a table across from a staffer on Capitol Hill and you tell them what the gaps in the literature are and then say we need more research, what can that staffer realistically do with that recommendation, given that they're not researchers? So a policy brief inherently involves having a policy audience, people who can really move the needle in terms of policy. Now that we've talked a little bit about what a brief is and what a brief isn't, and I think I've alluded to some of these earlier, but I have a top 10 list of what I think makes an effective brief, and this is from some training and a lot of trial and error. And yeah, it's sort of like my top 10 pointers. So we'll go through them one by one. This is going to seem intuitive, but briefs are brief. So policymakers do not have that much time to read because they're very busy. And so the shorter the better in a lot of ways. And so we often have to, when we get drafts as a committee to review, oftentimes the biggest piece of feedback we give is this is too long, this is too wordy, this is too dense. These paragraphs are not going to be read. So they're short. We have sort of a limit of 2 pages. However, 1 page is really preferable. And so I try to encourage people to try to get it down closer to 1 page, but that can be very difficult, especially for some of our academics who have been taught to overwrite, I think, in some ways. The second pointer, as I mentioned before, is that briefs are in lay language. So we don't want to use jargon terms. We want, if we do use any sort of acronyms or jargon, we want to define it in ways that, that are more digestible for a policy audience. Briefs include a summary of the research to support the recommendations. So one issue I see sometimes in health policy briefs that get proposed is that you get down to the recommendations, and the recommendations could be strong. The problem is that the body of the brief does not provide justification from the research to support those recommendations. So you really want to make sure that your arguments are supported and that when you get to the recommendations, nobody is surprised because you've already laid out the rationale from the literature. know your audience. So I mentioned with our health policy briefs, the audience is typically policymakers, legislators. However, there have been times where maybe that's not the appropriate audience. Sometimes the appropriate audience might be healthcare systems. And we have done that in terms of some of our cancer-related briefs where some of our recommendations are specific for policymakers, and then we have a different set of brief recommendations for healthcare providers or for healthcare systems. Another audience sometimes we've had before are school districts. So I think the question that you need to really ask yourself is, given this problem, I think that we're all pretty good at recognizing what the problem is, but we're not always good at doing the research to find out who can do something about it and how. So that who can do something about it would be your audience, and the how would be the recommendation. And we want to take all the guesswork out of the process for them, so the recommendation should be as specific as possible. I accidentally provided a segue to my 5th recommendation, which is to make sure that the audience can do something about the recommendation. That goes back to my example. If you're sitting across from a staffer on Capitol Hill, if you tell them more research is needed, we need more randomized controlled trials, they don't do that. So what they could do, for example, though, is to think about increasing NIH funding within a specific institute. They might think about specific funding opportunities to answer these research questions. But they're not going to be doing the research themselves, so you have to make your ask a little bit more specific. I see a hand raised. Should I, let's see. I think, let's see, I saw somebody raise their hand. I think how we're handling that is, do you want to type your question into the box so we can keep everyone muted? Ah, sorry. I think it was Stephen that might have had a hand raised. So if you want to just type your question into the box, I'd be happy to address it. Okay. So I'll go ahead and, oh, yep, Stephen. Stephen, do you mind going ahead and just putting your question in the box? I'll make sure to get you at the end, but I'll keep looking for it. So moving on in terms of other, oh, okay, we got it now. Okay. So I might save some of these questions for later, but I do think that this is a good question that just popped up in the chat, which is, how do you ensure that a policy brief is nonpartisan or neutral? And I think that's really an important question, because I feel like we're usually coming from a place where we have very strong political opinions about these issues, but you don't want to lose your audience. And the second that you lose your audience, you know, nothing's going to happen. The brief is not going to have any effect. So I think that what we try to do is stick to the science, stick to the facts, which, you know, doesn't always necessarily work. But the other thing to do, I think, is to try to find a different angle that might appeal to your particular audience. So the brief that comes to mind as an example would be that we were targeting school districts to try to get them to increase physical activity in the classroom. And we needed to provide a rationale that would be really attractive to school districts and administrators. So we focused on the academic achievement part. We know if kids move more during the day, that they do better in terms of concentration and things like that, and they end up performing better in schools. So we ended up using that as our angle, rather than using the angle of that we wanted to use, I think, in some ways, which was chronic disease prevention and obesity prevention. So I think that You definitely don't want to sound overly partisan. You want to be careful that you're not losing your audience. You don't want to attack anyone. We try not to use phrases like the Trump administration. We try not to call out like a single individual. We try to use more broad terms. And we feel like that's helpful. So, but yeah, you do have to be careful not to use language that's gonna make your listener shut down. So I think that's really important. Okay, so you don't need to necessarily cover all of the issues that are related to the topic, but you do need to cover the issues that are related to your recommendations. So just make sure that every recommendation is supported. Number 7, briefs need to be timely. So we have found that legislators will listen more if they are presented with an issue that is important to them right now. And so we have to be, if we can't find an angle that makes it timely, for example, that might not be the best time to put out a statement that isn't a hot button issue at the time. So just to give some examples, we have sometimes listened to what we used to do annual visits to Capitol Hill, and we would ask legislative aides, what do you want? What research do you want that's going to help inform your policy decisions? And a couple years in a row, everyone would say, we need research on rural health. We need research on opioid misuse. And these were some of the really important issues. And so we then put together authorship teams to write health policy briefs about those issues. Another year we had our Illinois Senator, Dick Durbin, asked us to write a policy brief on e-cigarette policies. And so we went ahead and put that together. So I think if you can get the topics from your legislators that are important to them, you're going to be more likely to be heard. And I think the other thing is that whatever you're seeing the most in the news, if you feel like you can jump in on that topic, that's a good one to jump in on, because that's going to get more reads and it's going to have more of an impact than an issue that might be less important. You want to have plenty of evidence to support your point of view. And all of our briefs address an important problem that's also relevant to our mission. So sometimes briefs get sent back to co-authors because it's not very clear how their recommendations link to our mission as a society. And also with the brief, you want to make sure that the position is really clearly stated. And so you want to make sure that that really jumps out on the document. And actually some of this has to do with formatting. I'm going to show you some examples, but some of it has to do with the formatting of the brief and putting the recommendations at the top of the brief rather than putting it at the bottom. So we've gotten a lot better at formatting the brief so that the position that we're taking is very clearly stated. So that is my very quick top 10. Those are my top 10 recommendations for how to develop an effective health policy brief. And there are many ways to put together a health policy brief, but SBM has sort of adopted our own structure so that our briefs tend to be in a similar format. And so I decided to go through that format using the example of one of our recent briefs that was led by Dr. Kareem Watson, who was also a collaborator on the CHEC project, and many others that also are collaborators of ours from UIC, Northwestern, NEIU. And this position statement urged Congress to ensure Affordable Care Act coverage of prostate cancer screening support services for high-risk men. That's a mouthful. Maybe we should have cut that title down a little bit. Nevertheless, it's a very important topic. And so you'll see right here, we have our recommendations on this first page, right, like, before you even get to the text. And the reason we did that is we found that when we went on these Hill visits, that staffers really wanted to know the bottom line first. Sure, give me the research later, but first tell me what you're asking for and what I should do, and then tell me how you're backing that up. So we started moving the recommendations to the front. In terms of the rest of the format, we typically have a summary statement that starts the brief. We have a statement of the problem. There has to be some kind of assessment of what is the current policy. because that then leads to the recommendation of how it should be different. So that's really important. And then of course the recommendations, which we spend the most time on because they're the most important, because like I said, that's really what they're going to want to see more than anything else. They want to know the research, and I'll share this with you. On our Hill visits, we found out that staffers on the Hill do not have access to PubMed, for example. And so even if they wanted to make evidence-informed decisions in terms of developing policies and bills, they actually don't have access to the research that we have access to as academics. And so that's really important in terms of, that really opened up my eyes to say, this isn't just something that I want to do on the side. This is something as a researcher that should be part of my job. Because if I'm not getting the message to that level, then I shouldn't be doing, what am I doing this for, in other words? And that is how my brain has shifted to think about this in terms of advocacy. Advocacy is the next step in research. Research doesn't just stop there, advocacy is next. And so I think what we should start thinking about a little bit more is like how everyone can be involved in these efforts. And to not shy away from it because of lack of training, but to really partner with groups like SBM that have an infrastructure in place and try to get your message across to those higher levels. So I mentioned the prostate cancer screening brief, and so I thought I would give you some examples of these 4 areas from that brief. So the summary statement from our prostate cancer screening brief, so the summary statement addresses what is the problem, what is the proposed solution, and what are actionable requests to federal legislators. So from our brief, this is the summary statement. The Society of Behavioral Medicine supports the United States Preventive Services Task Force guideline for the consideration of prostate cancer screening for high-risk men between the ages of 55 and 69. SBM encourages policymakers to include provisions for coverage of patient navigation services in the ACA to facilitate shared decision-making between providers and patients regarding screening. So a little bit of background, the impetus for this brief was that the task force put out some new recommendations. For lower risk groups, screening is not always recommended because it does carry some risks. But for higher risk groups, particularly Black men, there needs to be more of a conversation around pros and cons of prostate cancer screening, because it could be in their best interest to be screened because their rates are so much higher in terms of morbidity and mortality. So that was what the focus of the brief was. Like, yes, maybe not everyone needs to have screening, but high-risk men should at least have patient navigation services provided to them so they can make an informed decision. So next would be, what's the problem? And how can we cite some evidence in terms of what is the problem? So this is where you use your science to explain why the status quo is unacceptable. And in this case, the status quo is unacceptable because we don't want to leave behind these high-risk men who actually should potentially consider screening, despite the possible disadvantages of screening. And it's not that every African-American man should receive screening, but they should at least be supported in terms of shared decision-making around this. So here is our problem statement, and I won't read it out loud, but essentially you see that, the task force concluded that benefits were outweighed by the harms. And so in some cases, and so we have to be particularly mindful of whether or not screening is appropriate in African-American men, because the research tells us that they have a 70% greater risk of prostate cancer compared to white men and are twice as likely to die from the disease. So those are pieces of research that can really stand out to policymakers. And then we had to get into the nitty-gritty of the policy. So remember, the next piece is, what's the current policy? What is the current policy surrounding this problem? Is it adequate? Is it lacking? Or is it completely absent? Sometimes we come out in support of particular legislation that's been introduced. And so that's possible too. We're not always trying to correct something, but, you know, are we supporting this piece of legislation, or what are some of the downsides? And why should this policy be changed? What benefits might come of the change? And so again, this gets into some nitty-gritty, but essentially what we found out in terms of the policy around prostate cancer screening is that because the task force changed the screening rating to a C, that had implications for reimbursement. In other words, for the general population, because screening was not highly recommended for all men, there were recommendations in there for potential screening for at-risk men. But with the C rating, that would make it impossible for these men to have patient navigation services reimbursed through the Affordable Care Act. So it's a very specific piece of the policy that could create problems for these high-risk men to get the services that they need to make informed decisions about their health care. So that leads us to our recommendations. So what recommendations does the policy statement propose? Are they actionable? So make sure that it's something that can be done. What policy change will address this problem directly? And you want to avoid vague language as much as possible. One way I have trained myself to avoid this vague language is to pretend that I'm talking directly to the policymaker. And if I think they'll give me vague stares and they'll be really confused, then my recommendation is not done and I need to get more specific. Sometimes, you know, that means digging into certain specific pieces of a bill, not the whole bill, but specific sentences within the bill that are problematic. So sometimes this part is the hardest in terms of research because we know the science, but we might not know the nitty-gritty of the policy, and we have to dig in to find out exactly what's problematic about it, given what we know from the science. So in this case, we asked that to expand the provisions within the ACA that support use of patient navigators to ensure care coordination of cancer screening and follow-up for high-risk men. And so this was our important recommendation, given that this task force rating had implications for reimbursement. Hope that makes sense. So what I have here are some examples of some other SBM policy briefs that are cancer related and focus primarily on issues of health equity that can be informed by different policies. And as I said, with the prostate cancer brief, these briefs have include collaborators from ChicagoCHEC and also some of our community partners as well. This is our most recent cancer-related brief, which I thought was really important and impactful, led by Carl Ash. And this position statement was around the financial toxicity of cancer, which you've probably seen a lot more in the literature as of late. And the specific recommendations, so for example, as a researcher, you might think, okay, well, I know all the stats about how expensive cancer treatment is. And I know how much of a burden this is for cancer patients. And I know that this shouldn't be this way because cancer patients come in and they, you know, for some of you who are staff at community organizations that work with cancer patients, you might be able to see how this burden affects them in terms of their psychosocial functioning. In terms of those of you who do any clinical work, you might see how this financial burden is affecting your patients, but policymakers don't. And so we know that the research, we know this is a problem, but what can they do about it? And again, I think this is where it becomes an adventure for us who don't work in the policy space regularly, is to figure out what can this policymaker do about the financial toxicity of cancer. Some of our recommendations were to create a Medicare cap for cancer treatment. And that's really important because, you know, the bills are just becoming impossible for cancer patients to catch up with. Transition to clinical pathway payment programs, limit non-ACA compliant short-term health plans, and expand employer support of cancer treatment. That's another issue too, that a lot of medical leave programs don't last forever, and ensuring that cancer patients are able to extend these leaves so that they can be provided with salary support they need through their treatment and beyond. This was a few years ago. We put out a statement encouraging lung cancer screening services among high-risk populations, and you'll see our summary statement here. This is before we started putting the recommendations on top, so you'll see this brief has recommendations clearly right here with bullet points. We used to put a summary statement, so we keep kind of evolving as an organization. But our summary statement here is the Society of Behavioral Medicine supports low-dose computed tomography screening to reduce lung cancer mortality for eligible populations, particularly when screening is accompanied by tobacco treatment and shared decision-making. I think this was an important brief because it was a relatively new area in terms of the type of cancer screening. And then a couple of years ago, Karen Peterson led a brief about the importance of the early detection of oral cancers. So you can see that we have completed briefs across various specific types of cancer. And I think that's largely in part, that's largely due to the fact that Marion has done a great job working with all the collaborators within ChicagoCHEC to think about how we can really use their expertise to make more of an impact out of our research and make larger statements, both just in our fields, but also representing the goals of ChicagoCHEC. And so we've been able to put out a lot of great statements, but always looking for new ideas. And I said I was going to give you all a break from the pandemic, but I just want to say that we've been brainstorming some ideas around the pandemic because obviously it fits the bill in terms of being timely. And to be honest with you, right now, we feel like legislators are going to be very hyper-focused on the pandemic, as they should be. So we're thinking, how can we use our expertise to make some important policy statements regarding COVID? Marion co-led recently a position statement about the importance of really highlighting these racial and ethnic disparities that we're seeing in COVID. We're definitely seeing it in Chicago and across the country, and what we can do about that in terms of research recommendations and policy recommendations. So that should be coming out soon, but then we're also brainstorming some health policy briefs that we could hopefully get out quickly so that we don't miss the moment, because that's part of this too, is you have to jump in right at the right moment so that your statement has the most impact. All right, so we've learned so far how SBM develops these health policy briefs, what a health policy brief is, what are some of the tips for creating a brief, what format do we use in terms of what the brief looks like, and now I want to talk a little bit for a few minutes about dissemination. So I mentioned that this is our process, and I wanted to talk a little bit, no matter what I've tried to do, I can't get that one to stop spinning around, but the last step is that we like to partner with like-minded organizations. Here are some of the organizations that we have partnered with on our cancer-related briefs over the past 3 years: Wellness House, American Lung Association, ASTDD, and the American College of Radiology. So why do we engage partners? The Society of Behavioral Medicine is about 2,400 members, and so we do have our own dissemination plan within SBM, including putting it on our website, which is only one step, including it in our listserv. We also disseminate it on social media, Twitter and Facebook and LinkedIn. And then we also publish our pieces in one of our journals called Translational Behavioral Medicine as a peer-reviewed piece. But the reason we like to engage partners is because it helps us to develop relationships for future collaboration. It increases the impact of the briefs. We found that the briefs that get the most reads are the ones where we have the most partners, and those partners share in similar ways that we share them, and they really get a lot more of an impact. We also have found that including partners helps us to get a different perspective and some expertise that we may not have. I think the American College of Radiology is a really great example of that, because when we worked on the lung cancer screening brief, we didn't have that set of expertise in terms of our co-authors, so they provided us feedback from a radiology perspective. So as I mentioned, these are some of the ways that we disseminate our briefs. We also, like I mentioned, we used to do annual Hill visits to share our pieces with legislative aides, but now we email them out to legislative aides, and sometimes we'll tweet them at certain senators if we feel like it's particularly relevant for them. I mentioned our publication in Translational Behavioral Medicine, and that was an idea that Marion had to help us to really, unfortunately, a lot of us who are academics don't get credit for doing this type of work. I think it's becoming more and more of a part of promotion and tenure, but it's not always part of your packet. And so this way, junior investigators get a peer-reviewed publication as well. We're also starting to write op-ed pieces based on our briefs. So I was able to do that this past year with a brief that I wrote, where I then wrote an opinion piece for the Chicago Tribune to just try to reach a different audience and increase the impact. So there's really no end to this. We keep finding new ways to share these briefs with more people, and it's great. I feel like what we have done better at in the past 20 years is this research to practice translation. So we've been able to use our research to inform practice. What we've done poorly is this research to policy translation. And that's what the Society of Behavioral Medicine is really trying to do, to figure out how can we have a greater impact and really be heard by different audiences and work on our science communication skills and take everything to that next level. I wanted to also mention that the Health Policy Council, at the council level, what we're trying to do is a different type of advocacy. I saw in your questionnaires when you all RSVP'd that you were interested in learning about other ways to communicate with policymakers, and what our council is starting to do is to develop an ambassador program where we have identified 3 main policy issues that we want to tackle over the next 3 years. And then we have identified our members in key states that have legislators that champion these issues. And we're having these ambassadors work on building relationships with these legislators, inviting them to their labs. So these are things you all could think about doing. Or if you work for a community organization, same thing. You know, can you invite a legislator to come to your organization, talk about some of the issues that you all see in your work and what they can do to help? You know, can you build this relationship so that they think of you as the go-to person to educate them on the science? And I think that's really the next step of what we're trying to do in terms of our bigger policy agenda is how can we do more in terms of, yes, we could put these statements out, but can we also build relationships with legislators on a personal level so that when they are developing a bill on, let's say, prostate cancer related policies, that they'll think, I should contact this person who has expertise in this area. So that's what's next in terms of our policy agenda as an organization. So in conclusion, the Health Policy Committee of SBM creates and disseminates health policy briefs, and the goal is to impact population level health. You can be a part of it. Any of you can be a part of it if you have ideas that you want to run by us. And I think the important thing is to think about what policy issues matter the most to you, because I find that you'll be more intrinsically motivated to advocate if you have something, something burning inside of you that you really want to fix. If there's a wrong that you really want to make right, maybe you can start there and chase that issue. And you can help advocate for change, despite your level of training in terms of advocacy. Some people usually ask, well, what's the first step? We have a proposal process on our website, and so you would fill out this form. You know, you could talk to Marion or I because we work closely with the chair of the committee. And those are the first steps. And I'd just like to thank the committee and the council and the other related SBM groups, the co-authors of the briefs that I mentioned today, ChicagoCHEC, our partner organizations, and the SBM staff who helps us to format and really get these briefs out into the general population. So, so thank you so much for your time. And oh, let me mention one more thing and then I'm going to answer questions. The other thing that SBM does, let me try to get this. I think I'm going to have to stop my share for a second. Okay, and then I'm going to start it again. Feel free to type in some more questions while I show you this one last thing. So the other thing we do with the briefs that we found they get more traction is SBM staff develops these infographics. So for the prostate cancer screening brief that I showed you, we have this infographic that you could share on Twitter, for example. It shows what the issues are and what the recommendations are. And we found that infographics get a lot more retweets. This is the financial toxicity of cancer infographic. They get a lot more likes and retweets than if you just post the link. So it sounds silly, but these little things matter in terms of dissemination. So on our website, we have all of the briefs. We have all of the infographics, and they are organized by topic area. So I'm going to stop my share, and I'm going to try to answer some of your questions. Marian, while I'm looking at the questions, did you want to add anything?
Just a couple of things. Thank you so much, Joanna. That was so informative. And I know when this first started, I think for some people, maybe not everybody listening, it seemed a little overwhelming because it isn't the way we've been taught to write and really been taught to think. But certainly NIH and other institutions that are funders are looking for impact. And I think we have to start thinking that way rather than just saying, what's the next grant and what's the next scientific article? And that's what CHEC is all about too. Community partners, are we actually serving the nerds, the needs of this community so that they're involved, they want to participate, and we're moving cancer research forward. And I think that this outlet that Joanna is heading is such an opportunity to really be on cutting edge topics. And no area is out of bounds. We may find that we may have to arrange it and manipulate it so that it's brief ready. But Joanna she's really understated in the amount of hand-holding she does with people who are very interested in learning about this process. So I want to encourage people to come forward, to contact us, to contact Joanna and the chair, Akila, so that we really can begin to address these things in a more impactful way. And as she also mentioned, translational behavioral medicine will then peer review these so that there is a peer-reviewed publication on your biosketch, which I think many people then are looking at as a plus. So thanks, Joanna.
Thank you, Marian. Okay, so I'm going to answer a couple questions. I will start with the easy one, which is, can you post a copy of your slides? So Beverly, can you take care of sharing slides with the attendees? I'm fine with that.
Sure, I will share that.
Okay, great. Another question. The briefs you presented are also easy on the eye. Use of photos and color works well and helps reading the brief. Is there a formatted program you use? That's a really good question, Rebecca. We're lucky to have support staff through the Society of Behavioral Medicine, and then they work with a larger group of people who, they have a creative department. They do all the formatting for us, and so I'm not exactly sure what they use. They let me pick the photos, you know, they give me some options for photos, and then they make all the other magic happen. But I could look into what program they use. I feel like it might be Publisher, but I'm not sure. But thank you for that comment. I have a policy background and more limited research background. when it comes to health advocacy, I do, how can I best engage with researchers to be sure we're having the best, most informative conversations so the briefs I put together are consistent with the research? Camille, that's a really great question. Honestly, I feel like you would be a real asset to researchers, given that you know the language and they know the science. So I think, I don't know, I feel like it'd be a really great partnership for you to work with academics, but you might end up having to like you might need to edit some of what they write in terms of the science to change the language a bit. But I feel like that wouldn't be a problem. I mean, I think having a policy background is a real strength in terms of putting together a brief. And I think it's just that team science approach where you're trying to kind of, through discussions, figure out what the focus should be, and what research is needed and what maybe is not needed and what might be distracting. Okay, let me take Amisha's comment. Oh no, Almsha. Can you comment on type of references to be used? We do use peer-reviewed publications. We also use media reports in terms of references for the briefs. I would say the biggest thing is you don't need 50 references. You know, I mean, I think most of our briefs have somewhere between 7 and 12 references. So, you know, I try to use as much as possible. Can you use systematic reviews? Can you use really high impact pieces and other media outlets, and avoid citing like one RCT? Sometimes we do have that issue where somebody will want to do a health policy brief based on one study they did, and it really needs to be a well-researched area. So I would say try to use systematic reviews or meta-analyses to limit the number of references that you include. But yes, you can use all of those types of references. Another question. With a policy brief, you stated that you should provide recommendations. What about a research brief where statistics or descriptives would be used as background for policymakers? Would you then provide highlights, or would you suggest providing recommendations? I'm not sure if I fully understand the gist of that question. Because you do want to include, you can include some stats. I wouldn't include actual, you know, numbers, but you want to use results from impactful studies. And then those results would inform your recommendations. So I see them as going together. So I'm not sure if I have that exactly right, but I see a research brief and a policy brief as separate things, because a research brief is a summary of the research with more like research recommendations, whereas the policy brief is focused more on limitations of current policies and recommendations, but those recommendations are informed by research. That's the overlap I see there. I don't know how well I did on that one, probably not very well. What if you anticipate a wide audience? For example, you're providing background that may be used by policymakers, but you see it being used by community organizations as well. Yeah. So the question is, would this be two separate briefs? Sometimes we'll put different recommendations for different stakeholders within the same brief, but it'll be very clear. These are for policymakers, these are for community organizations. You could also develop two different briefs if you felt like it would be, if it would be better in terms of the audience you're targeting. So I would say both are options, but you just want to make sure that your recommendations are separated out by the target audience. I really appreciate this comment. I think smaller organizations don't understand our power. We are grassroots and frontline and see so much up close and personal. This helps us understand how to partner with organizations, researchers, and others to write a policy brief using our knowledge. Yes, and I think that's true. I think sometimes you are frontline, you see everything firsthand. And so not only do you have a different perspective and an important one, but you also, I think, really have the heart to know exactly what's going to help this population that you're serving. So I think that's really important. yeah, you can never underestimate the power of grassroots organizations. You know, I think about like Mothers Demand Action Against Gun Violence and Black Lives Matter. And those are all grassroots organizations that have made a huge impact. So I think never underestimate your power. Let's see. Anything else?
Joanna, I don't know if you see the Q&A questions
Yep.
button at the bottom. I've been pasting some of them as well, but if it's clear from that.
Oh yeah, I can see. I have that one open and the other one open, so I'm all set. I'm just making sure I didn't miss any. I see somebody's interested in a policy brief related to COVID. Ada, that's cool. Email us. Just making sure I have everybody. I see this question from earlier and I'm not exactly sure how to answer it. Marianne, maybe you can help. The question is, can you give examples of a brief about regulatory or administrative policy which may not be a legislative policy?
I think I would need a little more clarification on that. I think that when we think of the policies, it is in terms of what is the action that could be taken to either alter or, as Joanna said, support policies that are, you know, coming forth or already on the book. So I'm not sure what you mean. Maybe you can clarify that in writing by an administrative policy. So maybe you can go to another question and that person can clarify that a little bit, Joanna.
Yeah, so this is Ada. You can also feel free to follow up with me via email afterwards if you want to clarify a little bit more. But I think, does anyone else have a question? I think I covered everything that's here. Oh.
Joanna, I'm just thinking, people may have some ideas about policies and they're not quite sure if it is a policy relevant idea. So can those people email you?
Yeah, absolutely.
And then, you know, also then some guidance which you can provide, and, you know, I would be happy, or we can talk about it on our monthly calls, in terms of starting to create a team. Certainly for ChicagoCHEC specifically, we'd like it very much if somebody had an idea, if we could get people from each of our 3 institutions to be co-authors, but also our community partners. And we'd also love it if the community partners, and we've talked about this with the Community Steering Committee, if they have ideas, because that would be wonderful, where they're the lead authors and us as the researchers help to craft the policy brief. But we're really looking for that collaboration and impact.
Yes, thank you, Marianne.
I can maybe unmute just in case people want to ask their questions in person. So everyone should be is unmuted now, or can unmute themselves and talk.
I see a hand raise. Oh, okay, I see Alice.
Alice, you can unmute yourself.
I think they're having trouble unmuting themselves from what I'm seeing.
She's saying that Sabrina doesn't have the ability to unmute.
Yeah, I don't think they can unmute themselves.
I think you can do it now.
Okay, this is Aida. One of the questions that I asked was about regulatory policy. And the sample that comes to my mind, I think I've replied to all of you, is if you are advocating and coming up with a policy in terms of improvement of data collection in regard to the COVID-19, where there is severe undercount in the reporting of data for Latinos, Asian American, and other vulnerable population. That is not I don't need to go through Congress, to the legislators in Springfield for that kind of changes. It has to be done within the system of care. At the national level will be the U.S. Department of Health and Human Services through the Secretary of Health, in this case, Dr. Azar, or it could be done at the state level through the IDPA.
Yeah, Aida, though, there still has to be funding for that. And that could be something that could be a very good policy recommendation. So, I mean, it would have to trickle down into actually doing the testing, but advocating for increased funding for appropriate testing and also reporting by race ethnicity would be a very appropriate policy recommendation.
Right, so that's what I was getting at in terms of an administrative policy. Another policy that may has to do with, no, that policy will be regulation. Another policy could be administrative. When you are concerned about the lack of minority genetic counselor to be available for minority community, that could relate to an administrative policy. You want the entity that are recruiting genetic counselor, whether it's NIH now with the All of Us program or in any other setting. So that it calls for those that are appointed or appointed people in their leadership role to be able to take, be able to make changes in the way in which they conduct business. So that's what I was referring to, administrative policy.
Yeah, so I think that's a great point. I think you would just have a different audience. You know, you mentioned the Department of Health and Human Services. You mentioned some state-specific bodies. You might just have a different audience, and you just tailor the brief to that audience. And I think that would be appropriate.
Right.
Thank
I
you.
think there's also the option to create federal policy requiring a certain, in your example, a certain number of genetic counselors per, whatever the measurement is. So there are still federal oversights to these local level policies. Yeah. So and rather than just calling upon certain local agencies or politicians, you can still advocate for some of those things at the federal level and require it across the board.
Yeah, I think, Aida, many of those organizations then and institutions get their money from the federal government. I know that as far as genetic counselors go, I don't know this for sure, but I'm guessing that these agencies wouldn't mind hiring genetic counselors, but it's not the top priority if they have to hire nurses and primary care physicians. So once again, not everything is just advocating for more money, but there needs to be, you need to show the need for genetic counseling, and then the ask would be, there needs to be X number of genetic counselors per X number of people. But
the data that I have used, like for New York City or for the state of Illinois, indicate that when you look at certified, because they have to have a master's degree, certain training, etc. For certified, you only have like one bilingual person in the state of Illinois. I mean, obviously there's effort in trying to get more minority into genetic counseling, which is a relatively, not everybody's maybe interested or have become interested or knowledgeable. So that's what I'm referring to, that there is a very severe shortage or gap, and there's something has to be done in terms of bringing not only the awareness and through the policy, and we did that when we were concerned about NIH not training enough minority investigator, for example. That really called for another policy that has led to now funding available to recruit and train fellows that represent diversity.
Mhm.
I think that's a really good point. And I think it really depends on where you want to move the needle, and then decide who your audience is from there.
Right. And making it focused enough that you can have these asks. I think one thing that we tended to do more of was making things too broad so that policy people really wouldn't know how to act. And Joanna's very good at saying, is your ask actionable? And
Absolutely.
when you do that, you can see many times where you need to go.
I think Alice had a hand raised. Alice, you want to ask your question? How about Stephen?
Can they get off mute though? I see everybody on mute.
Yes, they can get off mute.
How about Andrea?
Hi, can you hear me?
Yes.
Hi, so I was the one who had the question about the policy briefs versus research briefs. And I was just thinking about our team puts out research briefs sometimes when we have like baseline statistics or something where we wouldn't necessarily put it in a peer-reviewed manuscript, but we think that the information will be helpful for policymakers or community organizations in terms of thinking about policies moving forward, but we're not necessarily presenting information on change in outcomes. And so previously what we've done is we've highlighted some of the summary statistics that we've got. So instead of providing recommendations, we've been providing highlights or key findings in the baseline statistics that we're looking at. But one of the things that I heard you say is that whether it's a policy brief or a research brief, that you should have some type of recommendation. So is that then, am I hearing you correctly, that we should always have some type of suggestion or recommendation for moving forward?
Yeah, I think that makes the most sense, because you can't just give people, even if it's just baseline data or whatever, people are going to want to know what to do with it. So to whatever extent you can, I think that makes sense. I think too, what you're describing sounds like sometimes when you're just, yeah, it just seems like a little bit of a different document to me, but you're just providing them with whatever data you have so far and hoping that that can help them make future decisions. And so, yeah, I think to whatever extent you can, a recommendation is always helpful. Like, here's the baseline data. What does this mean? What can we do about this? So I know that Stephen had a hand raised, but I don't know if he could. All right, Beverly, are we way over time? I thought we were only going till 1, but do we have more time than I thought?
I left it for up to 15 minutes after 1, just in case people had additional questions, but we have 5 more minutes. If there are any other pressing questions?
Cool.
Yeah, I have one more question. I know that when you're involved in advocacy organization that mobilize constituencies, whether it's around cancer or around diabetes or whatever, it would be good as a follow-up training to then talk about those community mobilization for action, which is based on a policy agree upon based on a problem, that everybody share. They believe that needs to be addressed in an urgency matter. So I wonder whether a follow-up training could be looking about how, once you formulate the policy, how you really could engage in the advocacy. And you mentioned it a little bit when you talk about some of the partnerships that you have developed. But I was thinking, and I think you mentioned as an example, talking to legislators. I know that when I was very heavily involved with diabetes at the national level, we used to have meetings that we would go to Congress and we would talk to legislators from different states to advocate for 3 priorities that the American Diabetes Association may have. And so that requires a different set of skills to articulate the policy, to come up with in a very brief way, a well articulated with a recommendation for action, et cetera, et cetera. And so I think it would be helpful at some later point, maybe another follow-up training. They could take it at that level for individuals that they are also, working at that level as well, or once you get involved, to mobilize constituency and have the direct contact with legislators, whether it's locally or nationally.
I think that's a great point. I did a training recently on community organizing. It was like a 2-part workshop, and it really opened my eyes because it showed me, just like you said, it's like, all right, now how do we go to the next step? How do we get a group of people together who feel the same way about this issue and really mobilize to make an impact?
Or how to use the media effectively to bring attention to the issue. That's another way that those kinds of recommendations could be given more attention by elected officials or whoever, the diverse audience that you're targeting.
Yes, and we actually have had health policy briefs that have gotten media attention, and the first authors have been interviewed by the news, and I do think those have even more of an impact. So I think it can help to just to see what you can do to amplify it even more.
Thank you.
Yep, thank you.
Is there any last question that someone may have?
I want to thank Joanna for just an absolutely excellent presentation and some very relevant questions. So thank you very much.
Thank you. Thank you so much for having me. And I do love talking about this work. And Marian, you're the one who trained me. So thank you.
Okay, thank you. Bye.
Take care.
Okay,
Everybody.
thank you, everyone. Thank you so much.
Thank
Bye.
you, Beverly.
Thank you.
Thank you.
Thank you for organizing.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Mitch.